Hi friends, welcome to my channel on Cardio Essentials. This is Srividya. We were talking about heart transplants in the previous video. So might be wondering, heart transplants, why? That is the last resource for surgeons, when other treatments for heart problems fail, leading to heart failure. So, what causes this heart failure in adults? One might be wondering. It can be a weakening of the heart muscle, that's called as cardiomyopathy, or it can be a coronary artery disease. It can be a heart valve disease, valvular diseases that we were discussing previous videos if you refer to. And then it can be like congenital heart defect, a heart problem when one is born with a congenital heart disease, or ventricular arrhythmias. Dangerously, it's like recurring abnormal. It is nothing but abnormal heartbeat, recurring abnormal heart rhythms. So it's not basically controlled by any other kind of treatments. Or it can also be like previously someone has undergone a heart transplant, but it wasn't successful. So usually if you take the young children, heart failure is most often, it's caused either by a congenital heart defect or cardiomyopathy. When you are talking about organ transplant, it can be performed exactly at the same time as a heart transplant. That's called like a multi-organ transplant, where the patient has conditions, certain conditions, and which leads to heart failure. So when we are talking about multi-organ transplant, what are we talking about here? When we talk about, it can be like heart kidney transplant. The kidney and a heart can be affected. It can lead to heart failure, kidney failure as well as heart failure. So anything in the body goes wrong, what is the first organ of sacrifice? So anything that goes wrong in the body, the first organ of sacrifice is the kidney. You have to be very careful. So this procedure may be option for some people like who have had like a kidney failure in addition to heart failure. Then the other option is heart liver transplant. This is where the patient has certain liver and heart conditions, both, or you have heart lung transplant. So this is usually not very common, it's very rare. Doctor may suggest this procedure with patients who have got like a very severe lung and heart diseases, which cannot be treated with anything, and has only option with a heart transplant or a lung transplant. So when you talk of a heart transplant, it's not something like everybody can take. Like I said, a basic assessment has to be done, whether it's a donor or a recipient. How good not only the physiological aspect, there are many other tests that's done to assess the patient condition, if the body of the patient can take the transplant surgery, whether it is heart kidney transplant, heart liver transplant, heart lung transplant. So it's not just or any other medical condition that could shorten their life. So even after one gets a good donor heart, still depends on how serious their patient's kidney condition is, patient's liver or lung condition is. So just receiving a very good heart and a very good heart donor does not entitle the success of a surgery. There are many other various factors that contributes to the successful surgery. So it can be infection, or the patient might have like a medical history of cancer, so they cannot be adaptive to the lifestyle changes. So they might be using some drugs. Basically, it's good practice not to smoke or consume alcohol. These both are like not good, not healthy. Have a healthy lifestyle, have a healthy diet. They say like fasting is not good. One needs to have a proper, every day there must be some kind of protein for the body to intake. For the organs to properly function, it needs good amount of oxygen and protein intake. Electrolytes needs to be balanced, and vitamin D3, magnesium, calcium, phosphorus. And if someone has got thyroid, they have to maintain the thyroid at normal levels. So for some people who cannot have a heart transplant, they might be wondering what to do. So the other thing doctors would suggest is ventricular assist device, VAD. So these devices are simply a mechanical pump which is implanted in the patient's chest that helps pump blood from the lower chambers of the heart ventricles to the rest of the body. So VADs or ventricular assist devices are commonly used only as a temporary source treatments for people waiting for heart transplants. So there are a lot of people, like I said before, waiting on the or there in the waiting list. If there are like 3,000 demands for a donor heart, the available donor hearts are only 2,000. So there's a big waiting list, and such peoples are administered and kept in the hospital till they get a donor heart. So meanwhile they are using this ventricular assist device. This is just a temporary treatment. So these are nowadays increasingly being used as a long-term treatment for those patients who have heart failure and for some reason are not considered as a good candidate for heart transplant. So this one ventricular assist device, don't think that it will help your heart. Doesn't help much. Doesn't help your heart. Doctor, then they might consider like a total artificial heart. This is a device that replaces the ventricles of the heart. Alternative short-term treatment. So there are varying treatments to maintain a patient till the patient gets a donor heart. So like I said, any surgery, small or big or a keyhole surgery, anything, the post-operative care and pre-operative care is very crucial. Surgeons may say the surgery is successful, and they might even in the hospitalization, patients might be really doing good under the medical care of the surgeon and the hospital staff. But the time starts when it has to be really taken care is the post-operative at home. Please, we tell the family members to be aware at least the basic knowledge of the medication that is given, constant monitoring of this patient. These are high risk patients. So open heart surgery is not as straightforward. It includes bleeding, infection might be there, blood clots. There might be a lot when you are talking about a heart transplant surgery. So it can be a rejection of the donor heart. So the most crucial risk is once the heart is successfully placed into the heart cavity in the recipient, there should not be any rejection of the donor heart. The immune system of the patient should not see the heart as a foreign object and try to reject it. This is the process when the heart can undergo damage. So that is when the surgeons give lot of medications to prevent this rejection after the surgery is successful, immunosuppressants, and result is the rate of organ rejection continues to decrease. Sometimes they change the medications to stop the rejection if it occurs. So it's critical. So medications are to be administered very carefully. It's a high risk commitment, very carefully. And all the appointments, not one appointment should be missed, because it's a very complex surgery. Heart transplant is not whether it is a heart lung transplant, heart liver transplant, heart kidney transplant, any transplant is not a straightforward. It's a complex process. Rejection occurs without symptoms. So whether the patient's body is rejecting the new organ. So that's why to see it, they do like heart biopsies during the first year of the transplant. Later on, like everything goes on well, they don't need the biopsies. Then so sometimes when the primary graft fails, the patient might die in the first few months of transplant. So the donor heart might not function well. And sometimes the problem is with the arteries, after the transplant, the walls of the arteries in the heart could thicken and harden, leading to cardiac allograft vasculopathy, they say. So which makes the blood circulation through the heart very difficult, and it can easily cause a heart attack, heart arrhythmias, or sudden cardiac death. Then it can also be medication side effects, the immunosuppressants that's being given for the rest of life can have a serious damage on the kidney or various other problems. Then the other factor is cancer. So when the doctor is prescribing immunosuppressants, it also it can also increase the risk of developing cancer. So the patient has to be very careful what medication has to be given, and what are the side effects, how is the body reacting, and they can end up in a greater risk of skin cancer or non-Hodgkin's lymphoma or many other types of cancer. Then other risk factor is the infection. The immunosuppressants decrease the ability to fight infection. So who have got the heart transplants can have infection very easily, So it is very crucial for the post-operative care is very crucial for any transplant patients. With this, I'm going to end my video. If you like my videos, please subscribe to that. We'll be discussing more about heart, good health, and wishing you all a very healthy and long life. Thank you and God bless.